Good evening, everyone. Welcome to our town hall event tonight here at 7 o'clock. We want to get started here. We've got a number of individuals, community leaders from across Todd and Wadena County joining us here tonight. We've got representation from the school systems here in those areas. We've also got public health officials from both Todd and Wadena County, and then we've also got representation from some of my colleagues at Lakewood Health System here joining us tonight. And our reason for pulling together this meeting is really to kind of give a general update from all of our unique perspectives regarding the current situation with COVID-19. We're all sort of in this struggle together. I know if you're watching the media, which I'm sure many of you are, we are hearing a lot about an uptick in cases, and we're just seeing an uptick in the prevalence that we're seeing across the community. And so we wanted to really bring a lot of these individuals together just to give that unique perspective and allow them to kind of talk about some of the things that they're dealing with on a regular basis and seeing in the community at large right now too. So with that, a couple of ground rules for those folks who are tuning in with us tonight. We do have a chat feature in the upper right-hand corner of the screen. Throughout the night, if you have questions specific for anybody or just general questions, if you want to type those in throughout the evening as our presenters are talking, we will then, at the end of the conversation, when everyone's had a chance to share, we'll round back and try to answer those questions as best we can. So know that we'll do everything we can to get to all of those questions as they come up. So with that, I want to introduce some of the folks that are with us tonight, and then we will get started with our conversation. From Lakewood, joining us tonight are going to be President and CEO, Mr. Tim Rice. We also have with us tonight Dr. Christine Albrecht. She is a family medicine provider and Chief Medical Officer at Lakewood Health System. We have Corrine Nisus. She is our Vice President of Nursing at Lakewood Health System. She is joining us tonight. Running technical support in the background for us. Can't do any of this without him. Mr. Jim Roeder from Lakewood Health System. He is our VP of Internet Technology. So he is with us tonight as well. And then from other leaders from the community that we have here with us tonight, Jackie Ock, she is the Health and Human Services Director at Todd County. We also have joining us tonight Cindy Peterson, Public Health Director in Wadena County. And then joining us from representing the school systems in our area, Shane Tappy, Superintendent at Staples-Motley School District, and Dave Endicott, Dean at Central Lakes College at the campus in Staples. So with that, I am going to start us off. First up, I am going to introduce Dr. Christine Albrecht, and she's going to give us an update from a Lakewood perspective on some of the different things that we are seeing recently. So hang tight. I'm going to transfer her to right now. You're up.
So I'm going to talk a little bit about staffing and what we're going through at Lakewood with COVID-19 right now. I think everybody knows that our prevalence rates are up and the state's at 9%, and that actually makes us right now like the 9th in the state for our prevalence, and our area is right around that 15%, and St. Cloud area is at 20% for prevalence. So what that means is there's just a lot of community spread in our area, and that has hit us really hard staffing, and right now we have 54 of our staff members out. And so all areas across the entire health system have been hit by this. And then that creates difficulty in how we are able to care for everybody. We have to be very creative in how we adapt our staffing for all of that. And so I just kind of wanted to chat a little bit about that and how that affects everything we do at Lakewood. We know that ICU beds and medical surgical beds across the entire state are really tight. In fact, we have to report our bed status 3 times a day right now to the state, just because there's such a shortage and they want to know where beds are available for hospitalized people. We've been asked by the larger hospitals in the area to keep people that we would normally send out just because there's not enough beds elsewhere for them. And so we have to ensure that we have staffing to take care of these higher level of care patients than a lot of times we're used to doing. We have been treating COVID patients at Lakewood, and we feel that we're doing a great job. We're doing, we're using remdesivir, we're using the latest treatments, we have high flow oxygen. So we've been taking care of a lot of COVID patients. And in fact, for a little while, we had to take our negative pressure rooms and actually double them up for a little bit, put 2 beds in a room, just so we can make sure we can care for everybody in the community. And we have surge plans in place, definitely looking at that in the future of how we do that and how we change providers from doing a well clinic to maybe having more people doing emergency department, sick care, and hospital patient care around the clock. One of the great things that we've done lately is we've made our drive-up testing much easier. So now when you call a number for Lakewood, if you call in, it'll say, one of the first things it says is, if you would like to request a COVID test or you have questions about a COVID test, please press 1. And that will get you right to a live person who will help you schedule that test and get the drive-up testing done. We're sitting really good with our supplies for send out tests, and we're happy with that. So that was one of the big deals recently. We actually just got our, we call it our COVID castle, and it's sitting in Lakewood right now, and our drive-up testing will kind of be starting going through there soon. So that'll be nice for our staff to be able to sit in the nice warm heated area this winter and just step out to the people's cars to do their testing. So lots of exciting things going on. We were getting very creative on how we staff, and I just kind of wanted to talk more about the staffing piece of things, and then I was going to let Corrine talk more about the space and the stuff that's going on at Lakewood.
So I don't know if Matt was introduced me or not, but I noticed I see I'm up on live in red, so I'm assuming it's me next. So as Dr. Albrecht mentioned, when we talk about all of our emergency preparedness plans, a lot of times how we do it, just to break it up into, basically what do we need for space, what do we need for stuff, and what do we need for staff. And as Dr. Albrecht talked, a lot of what we had done about staffing. As far as our space, really right from the beginning, we were always looking to see how can we make the best use of our existing space, and what did we have to do for adjustments, whether it was traffic flow, to protect anybody that's coming into our facility, trying to segregate people that maybe would have been coming in for more well type of visits versus those individuals that were coming in seeking really kind of what you would think of as sick care. And over the months that we have been working on planning, we did some different strategies. At one point, we looked at how to best utilize our clinic spaces and shifted some of our cares, some of our services over to our clinics, such as in Pillager, where for a time period we had women's health and OB and some dedicated staff over there. But as time has gone on and as the pandemic has evolved and certain services we resumed, we've had to make our adjustments to our plans, and we still had some great opportunity in there when there were some months before the surge we are experiencing now had really started, and as Dr. Albrecht referenced, we were able to retrofit some of the rooms up on our med-surg unit and create a negative pressure, basically a negative pressure wing. So we do have 8 rooms on that makes it safer for our staff and our other patients in the facility. And with those 8 rooms as part of our surge planning, we would actually be able to have that be doubled up. And so we'd have that capacity of up to 16 on that wing. I think as time has gone on, we've recognized that maybe space won't be as much of a challenge to us as staffing. And that's the same thing that we hear from other healthcare facilities in the state, that staffing is really getting to be the most difficult piece. Even if we've got the stuff to provide them with the personal protective equipment and the space to care for these patients, staffing is really tight as they also experience illness or we have them out with high risk exposures. We've made some adjustments also to adapt to just the changes in seasons, and as Dr. Albrecht mentioned, looking to have our 2 COVID castles or our ice fishing houses that have been converted over so that we can have staff working out of those and still facilitate that type of drive-by testing for those folks that really do not need to come in for any other service, and it just limits that opportunity or that chance of those individuals exposing other visitors or patients in our facilities. So we continue to work on that. As far as stuff, as you know, many might have remembered when things were first shut down back in March. A lot of those efforts were really to allow facilities to build up their personal protective equipment supplies. And so you might remember there was actually, the veterinarians, the dental services, a lot of those things were temporarily halted. And we did follow the recommendations from the Department of Health and from the CDC as far as conservation methods to try to preserve our PPE supplies. We actually went into that period really in pretty good standing. We were able to pretty successfully manage our supplies of PPE. So we were fortunate that our staff didn't experience the shortages that you might have heard about in other facilities. We feel really fortunate to have a really strong department that's been managing that. We also had a really great experience with having some community volunteers that did do sewing of cloth masks, and we were able to do some universal masking for all of our staff early on, using those cloth masks for our people that were in the non-clinical areas. With the more extended time that we have had, we have been fortunate to be able to get some additional supplies, things like PAPR hoods, some additional ventilators. Had the prepared for that, and there's just been a little bit better ability to get those supplies through our conventional purchasing vendors. So we feel like going into the surge right now, we're standing in good stead as far as what you would call the stuff. And actually we feel pretty good on the space, but as we mentioned, really right now, our limiting factor is probably going to be our staffing. And with that, Matt, I'd let you have it back.
Thank you, Karina. I apologize. I was on mute last time, of course. How many meetings have we been in where we've done that lately, for Pete's sakes? Anyways, thank you both, Dr. Albrecht and Chris and Karine, for your updates on that. Much appreciated. And again, staffing, I think we're probably going to hear a recurring theme here tonight from some of our folks. Next up, I want to turn this over to Jackie Ock. She is the Health and Human Services Director at Todd County. Let me get her dialed up. And Jackie, we are ready when you are.
Good evening, everyone. Thank you for the invitation and presenting tonight. Just to kind of give you an update on where we're at with Todd County. As of today, we have 1,088 cases in Todd County. We have 36 additional cases noted today alone. Generally, it's been averaging, last reported at our board meeting on Monday, 10% of those cases no longer needing isolation, but we're finding it's generally, like most people know, it's community spread. And we're finding that it's in households where the spread is happening, and countywide there is truly no hot spots. We are looking at the positivity rates. Todd County is one of the highest in the state again. Dates being between October 18th and 24. We are at a 19.5% positivity rate, so we're seeing a very high exposure, which is generally, if I understand right from Dr. Christine Albright, pretty much what the state average is currently. We continue to work closely with our schools around their safe learning plans and guidance. We are preparing for mass vaccinations when that vaccine becomes ready, either be a drive-through or a walk-through clinic, weather permitting, and trying to utilize that expo building at our fairgrounds and try those dry practice runs as much as possible to try and work out just our traffic control and flow it within the buildings as it would be a drive-through building. We work on putting out press releases as much as we can to keep the general public updated on what's going on with COVID, but not trying not to put out too many press releases to where they become ineffective as well. So our case average, we're seeing that ages are between 40 and 43 are generally our years of age. And right now, as of today, we have 9 COVID-related deaths within our county. That's my report. Thank you, Matthew.
All right. Thank you, Jackie. We appreciate that. Next up, I'm going to turn it over to Cindy Peterson, Public Health Director in Wadena County. And let me pull her up 1 second.
Okay.
Ready when you are, Cindy.
Okay, thank you, and thank you for the opportunity to be here this evening. Just a few things about Wadena County. We have currently 348 cases, 5 deaths. Where we get to see a little bit ahead, and we are thinking we're going to have at least 31 cases new showing up tomorrow. Just a little history from April to July, we had 24 cases in 4 months. August, we had 24 cases. September, 41. October, right now, we're thinking it's going to land around 250 or higher. And so just really an exponential growth that we're seeing in our county as we are seeing across the state. We have had a high number of congregate care exposures. We had a long-term care outbreak in our county. We actually have 3 long-term care facilities in Wadena County. We have a high number of community known as well, just like Todd County, and that really shows wide community spread. Let's see, our ages, our biggest age group is the 50 to 59, and that's a little different than what you see statewide, which is more in the 20s, 30s, and so that's a little bit different. Our next 2 highest are 60 to 69 and 40 to 49. So a little different pattern than we're seeing in some other places. We also are working with our schools, and the schools are using something called a 14-day rate as part of their decision making. So we look at those rates with the schools each week at meetings. 50 is kind of the cutoff early on for where it would be all distance learning. This week in Wadena County, the rate was 80 for the 2 weeks was 84.27 for October 11th to October 24th, and 108.2 in Todd County. So these high numbers that we're seeing in our community really do affect our partners. They affect our schools. We already talked about that. They affect their safe learning plans. They affect long-term care. And as I said, we have 3 in our county. In Wadena County, 21% of our population is 65 and older, and in the state, that's 15.8%. So we have a larger proportion of elderly in our community. We also, in addition to the 3 long-term cares, we have a lot of congregate care settings, as are in many of our counties. And so we have a lot of vulnerable population in our county, and what's happening in the community really does affect that setting. And not only does it affect the residents, it affects the people who work there as well. We also work a lot with businesses, and some of the primary sites for exposure and right now are in office and retail settings, so we get a lot of calls for that. In Wadena County, we also license food establishments, so have been working with them right along. And so I guess what I would just like to say is that, you know, what we do as individuals really does make a difference, and because it makes a difference what happens in our community, and it really does affect a lot of the partner organizations. So thank you.
Thank you, Cindy. We appreciate your update. Both of you, Jackie and Cindy from Public Health, thank you so much for being here tonight. Next up, we're going to jump to Mr. Shane Tappy from Superintendent, Staples-Motley School District. Let me get him dialed up. Second. Shane, we're ready when you are.
All right. Thanks, Matt. Good evening, everyone. Appreciate the opportunity to be here tonight to share some interesting information as we work through this unprecedented time in education. I want to take a little time to talk about the scalpel approach that Deputy Commissioner Heather Mueller put out for schools to work through as we continue to monitor COVID-19. The scalpel approach focuses on not only our county data, but our in-school data and the amount of cases that we deal with within our school systems. We are working with our county officials. We are working with our team at Sourcewell, and we continue to work through with local superintendents and other districts as well. While many of these numbers are high, what we are fortunate to see is not a lot of spread amongst younger folks. We are also dealing with staffing situations like many of you. And of course, our staffing situations tend to filter out into other organizations, those parents who have to stay home with their children that may have been exposed and had to quarantine. But certainly it's something that we're working through. Right now we're in a hybrid model for our 7-12 facility, and our K-6 is currently in-person learning. While we continue to monitor this on a daily basis, it certainly has evolved and changed as of recent. Again, like I mentioned, attendance is certainly a component that we are monitoring daily with both staff and students. We also have some information from the Minnesota State High School League that we are monitoring as our activities continue to be worked through. We're dealing with that on a daily basis as well. So it's a situation where many of our folks are working diligently to ensure social distancing taking place. Masking has been something that we're focusing on, and you can about imagine with middle school and high school kids is not always easy, and I think it's never going to be perfect, but certainly our staff has done a great job working through those situations. But other than that, we're working hard to make sure that we provide a safe educational environment for our staff and students. And we're dealing with many of the things that you guys are all reporting on. I don't want to sound like a broken record, but the attendance piece, staff, and then of course the different learning models that we have within our school system. We do have a fair number of students and families that have chose distance learning. So we are providing those opportunities to our folks as well. So proud of our staff and how they've handled the situation, and it certainly has evolved as of recent. So that's, yeah, I guess that's about all I got tonight, Matt. Thanks.
Thank you, Shane. We appreciate the update. Next up, our final presenter tonight. Let me get him pulled up. Mr. David Endicott from Central Lakes College, the dean there here at the Staples campus. Dave, let me get you pulled up. We are ready when you are.
All right. Thank you, Matt. Thank you for the opportunity to be a part of this. Central Lakes, you're going to hear some similar themes again. I'll repeat some of that. I'll start with the celebrations. First of all, our enrollment actually on the Staples campus is up from last year, which is quite remarkable considering the pandemic and all of the different situations that are going on. So we're up slightly. We also have all of our programs operating primarily face-to-face because we're all career tech programs on the Staples campus. The Brainerd campus is a little different in that the liberal arts programs are primarily online, but because our career tech fields require that hands-on experience, their certifications depend on those hands-on experiences as well, and those clinicals in our nursing programs. So we've done everything we can to try to ensure that our students can get the best education possible face-to-face as safely as we can. So we've had to change a lot of the capacities within each classroom, creating extra sections so that we can divide students up into smaller sections, making sure lab partners are the same throughout the semester and not exchanging those lab partners, that they work in the same spaces, those kinds of things that would typically be different in a normal situation. Our staff has done a phenomenal job of really having to change schedules in a significant way in some of the programs in order to meet the needs of students. As everybody else has mentioned, the attendance pieces. We've had about 250 students on the Staples campus, and currently we have 38 students quarantining. That has, that fluctuates week to week, month to month, day to day. But what happens then is those students miss a chunk of time, whether that be 10 days or 14 days or whatever the quarantine calls for. And so then it's how do we catch them up? If they've only got class 2 or 3 days a week, that's a pretty significant amount of time that's lost with their instruction. So the staff our faculty members have done a remarkable job of creating extra opportunities for students to make up that work, get their experiences, whether it be in heavy equipment in the trucks or nursing with clinicals or any of those kinds of things, robotics in their labs and all those different programs that are going on. So we're, like everybody else, kind of scrambling day by day, and to be honest, we kind of make it up as we go because none of us have ever done this before. But we've been able to keep all of our programs open to date. There is a program in Brainerd that's taken a couple week online hiatus from their normal face-to-face pieces, just to mitigate any possible exposures that are going on. Other than that, we're hopeful we can get through this first semester, and we've got some students that their programs end at this semester, and we're hopeful we can get them all through that. And then we continue to monitor the county data. We're similar to the public school system that Shane talked about, in that we have some scenarios that we are very similar to what Department of Ed has put out for those guys. We also have Minnesota State, our college systems, that gives us guidance on what that looks like. And so every day we're looking at numbers, countywide, community-wide, and within the schools, each of our campuses. We also look within each program. So I think we've kind of narrowed our focus to where we're thinking we have to close both campuses. This program has seen a significant increase in the number of students that have been exposed or have been found to be positive. And so we can focus on that program and still keep the exposure rates low. Because there's not a lot of intercrossing between programs. We don't know, that may get tougher as these numbers spike. We're going to find it to be more and more difficult. Most of what we've seen has been community exposure. We've had a couple of programs that we've seen the exposures happening within the program, and then we've had to kind of change course for that. But overall, I think we got to be pretty thankful we've been able to manage to get this far with all of our programs still being able to operate as they are, and hopefully giving our students an excellent education in the process.
Dave, thank you so much for that update. We appreciate it. So I think the overall theme tonight, it sounds like a lot of hard work, a lot of scrambling, it sounds like, but we're making it work. A lot of people pulling together and making these things happen. So what I would like to do now is, that was our final presenter. I want to remind those listening out there tonight, if they have questions, that there's a question and answer icon in the upper right-hand corner. If you want to come ahead and shoot us some questions, we'll do our very best to get those answered. And while you are coming up with fantastic questions, I did want to turn it over as well to Mr. Tim Rice, our president and CEO at Lakewood. He had a few words that he also wanted to share with folks tonight as well. So Tim, I'm going to throw it to you. Give me 1 second. Ready when you are, sir.
Yeah, thank you, Matt. We just really from Lakewood Health System, we just want to thank these presenters for being here to be part of this virtual town hall. I think some key things that we appreciate is just you all taking the time to share with us, the current status, what's happening, but also for how we all work together. And I think that's something really special about our area and region. I've heard some themes here too that I think is critical to mention. Just how proud we are of our employees and our staff for their focus on why we're all here to best serve the needs of our community. But my goodness, their flexibility, their adaptability, and just their passion for focusing on really no matter what gets thrown their way, focusing on why we're all here and making sure that we can best serve our communities. So I guess from our standpoint too, we're so fortunate to have such great partners with all of these organizations. And we have a history of how do we, no matter what comes our way, how do we focus on working together to best address the challenges that we are facing. So just want to thank all of you for participating and just being great partners in our community. So thanks, Matt.
Thank you, Tim. I appreciate that. So with that, I wanted to just remind listeners again that they have the opportunity to share with us any questions that they've got. Jim, do you see any other questions out there right now?
No, no questions at this time.
Okay. That's great. Okay. Well, I can hang on just a little bit longer here. Oh, we got one here. We have one question that just popped up. Is there a possible prediction as to when we may enter distance learning? Mr. Tappy, would you like to care to tackle that question?
Sure. We are monitoring that data on a day-to-day basis, and certainly I think we are closer now than we were a while back. And you know, I think the thing to remember is we have a lot of space within our facilities. I think that our big focus is to focus on the learning of our students, and we understand that there is no one size fits all, and realize that the impact that distance learning has not only on our kids, but on our families and on our partners. And while we may get to that point, we're going to continue to try to hold on to hybrid learning as long as we can, and as safe as, or with the idea that safety is our highest priority. So I guess I don't have a definitive answer. And again, we always provide that opportunity to families that if they do choose distance learning, that is available to them. But I don't know that I have a definitive answer to the question, but you know, it's something that we're continuing to monitor, and obviously staffing is a huge component of that. If we can continue to staff the building and it's safe, we will continue to try to in hybrid. But if we can't, that may result putting us into a distance learning model.
Okay. Thank you, Shane. I think there's a follow-up question that if schools in the area are above the 50 per 10,000 mark, which then would indicate distance learning for all, why have we not gone to distance learning yet?
I think I mentioned that scalpel approach, and talking to the Minnesota Department of Health and the Commissioner Heather Mueller specifically, we've worked through this conversation of you know, there's schools within the same county that may have distance learning models, and it's how the effects have in regards to not only community spread, because that's the data that people are seeing of the 50. Is we also have to look at the data within our school system and with our groups of students within our school system and our activities. And at this point in time, we haven't seen any of that large communal spread within our school facility.
This is Cindy, and I can talk to that just a little bit as well. The 14-day school rates are just one piece that's looked at with the schools. We've been fortunate to have weekly phone calls between the schools, public health, and the Minnesota Department of Health and Sourcewell. And so when things have changed somewhat and we need some discussion. That's been a really nice way to do that. And we've had good access to epidemiologists from the Minnesota Department of Health that have been helpful with the decision making. The 50 number was really kind of the number for starting the school year and isn't as strict of a cutoff as it was then. So we feel like the discussion and the schools have really been making good decisions and really working hard at keeping the kids safe.
Thank you, Cindy.
And Matt, I'll just mirror that. I mean, I really appreciate the partnerships that we've had with our county folks and our folks at Sourcewell. I really think that the team of people helps guide this process and give us the best opportunity to be successful with many different factors. Like I mentioned earlier, as we continue to make decisions on a daily with an ever-changing and ever-evolving situation. And I'll kind of piggyback off of what Dave said, Etiquette, you know, a lot of what we are working through, none of us have done before, and we continue to just be so proud of the work that our staff is doing and our supporters within Lakewood and public health and all of the folks that help guide us through this. So I just appreciate the team effort to continue to provide the great education that our kids continue to get.
Fantastic. Thank you guys for your answers. Great answers. Next question up here. We have a question. What does the next month look like for case growth? And at what point does it stop going up? I don't know who wants to answer that one, if we want public health or if we would like Dr. Albrecht, if you'd like to take that one. No?
This is Jackie from Todd County Public Health. I would love to hand that off to Dr. Albrecht, but that's a lot of unknown. If we had that magic ball, I think we would all be sharing that information. But we're finding that we're seeing communal transmission because people are moving activities inside or indoors versus being able to have that opportunity to have it in green space or outside. So I think it takes time. And transmission once there's been exposure, and I think we're going to see this through our cold months. Dr. Albright or Cindy, did I miss anything?
I think you nailed it, Jackie. I think that they're expecting things to not get better soon.
Right. I would say that we're looking at least through the regular flu season. I mean, I think until spring is maybe when things will slow down. It just doesn't show any signs of slowing down right now.
Got it. Thank you all. Appreciate you all for contributing to that answer as well. Next up, we have a question here. When there was a surge in other areas, hospitals ran into a shortage of respirators. Does Lakewood have a plan if it reaches that point? Corrine or Dr. Albrecht?
I could take that for a little bit.
Okay.
So respirators, meaning ventilators. Initially when we were just learning about COVID, the idea was put people on ventilators early. And that was kind of the guidance. And so if somebody needed more than 4 liters of oxygen, they should be on a ventilator. The science has changed dramatically since then, and we don't believe that's true. So most of our patients don't end up on ventilators. So far, we have not had to keep anybody on a ventilator at Lakewood. Those patients that have needed that have been able to be sent out, and we're hoping that that continues, obviously. But we have secured more ventilators at Lakewood, and so we do have a significant number of them. We feel pretty good about that, but I'm hoping that we don't get to that point. I'm hoping that another thing, like just staffing people on ventilators is hard. They take a lot of extra care, those ICU patients, and so we have the stuff again. It's going to be a lot of it. How do we have the staff to manage these patients if we get there? Anything to add to that, Corrine?
No. Okay.
Yes. Oh, I wasn't sure if I had to wait for you to.
No, you go right ahead.
I would say yes. I mean, I think actually what we were trying very hard to do is to be able to equip ourselves to be able to keep the patients that we thought we could safely manage here at Lakewood. And so we have kept I would say the majority of our patients that we've had, we've had to transport a few out, but we work hard to keep as many as we can here safely, so that if we do have to send somebody out, that those larger facilities have the beds available. So by us keeping those ones that we can safely manage here, we're really working to try to keep those other beds open in those larger facilities for these more acutely ill folks that maybe need some more specialists, a little bit higher level of care than we could provide here. But and we have steadily been seeing an increased census throughout really throughout October into November.
Thank you, Corinne. Appreciate that. One other question here. Aren't most kids asymptomatic, and shouldn't we assume there are more cases in school? Anyone want to answer that one?
I think that we know that children get less of a case than adults do in general, and some are asymptomatic, some just have cold symptoms. I mean, if you get very sick, we know that, but in general, right, they have less symptoms, and it's hard to tell the difference between a cold and COVID in a lot of these children. And that's why we're trying, that's why the schools are trying to screen, and we're trying to screen too, just say, anybody who's sick, get tested, stay home, try to stop the spread. Because the goofy thing with COVID is there are a lot of people who are asymptomatic. It's not just children. I mean, there are so many people that are asymptomatic, especially, you shed your highest viral load the day before you become symptomatic. That's like chaos for us in this field to try to stop that when you're shedding before you're ever symptomatic. And by the time you actually have a lot of symptoms, you're not even shedding as much anymore. So trying to stop it is hard. So I think is there more out there than we know of? Absolutely. Absolutely. There's a lot more prevalence than what we can measure right now. And not everybody gets a test. That's the other thing, not everybody's getting tested that's sick. Some people just stay home and don't want to get tested. Some people just don't, or some people think, well, I know my family member had it, I know I have it, so why should I get tested? And there's some truth to that, but it doesn't help our data or our numbers.
Thank you, Dr. Albrecht. Let's see. Any other one? There was a comment back here before. I just wanted to make sure I got to it. It says, thank you to Lakewood and Jackie Ock on keeping us up to date throughout this pandemic with timely and important information. So just more of a statement. So thank you. Kudos to you. And then we did have one other question come in. The question is, what are the main reasons that we are seeing so much spread right now? And do you feel people are taking this serious enough when they are outside of work, like wearing masks and not getting together in groups? Does anyone want to jump in on that one?
That one might be, this is Jackie, that one might be a little bit harder to answer. It's about perception. We encourage, again, that's why we really talk about social distancing and masking. Those preventative measures go a long way. And keeping in mind masking protects others from you. So it's important, but it's hard to, perception is important as well. If people are taking it serious outside of work, that's it's pretty subjective and hard to measure at this point, but we try to advocate and educate as much as we can around prevention. And prevention is hard to measure. It truly is, but it's very important.
This is Cindy from Public Health in Wadena. I will just add to that as community spread increases, people in settings where we used to feel a little bit of comfort, like within our homes, if we had relatives over, those kinds of small groups that we used to feel a little more comfortable in with increased community spread, those are settings that we are seeing spread occurring in, and those are settings where we should be careful as well. Social distance, mask, maybe don't have some of those gatherings. So to really think of protecting yourself even in those types of situations and others.
Thank you, Cindy. Appreciate that. That's what makes this so tricky, isn't it? We got all these holidays coming up and we got everybody wanting to get together. It's just such a difficult situation. And then Dr. Albrecht, you're referring to the fact that you're shedding most of your virus before you even know you're contagious. So it's just a different animal we're all dealing with. One more question that came up. Why is data for testing important? Anybody want to jump in on that one?
I think it helps to drive a lot of our decisions as a community and as a state. I mean, when do we shut the schools down? When do, are things rising in our area? Are they not? And the data is never going to be perfect. Like we said, not everybody gets tested and, and some people don't get tested till after they're not shedding enough virus to turn positive anymore. And we have all of those things going on. But I think that the only way we're going to learn about COVID is by data and by science. And I think we've learned so much in the medical field about what works and what doesn't work already. And, we know that laying people on their belly is important during COVID. We know that repositioning them every 2 hours is important. We're learning like high flow oxygen is good, ibuprofen is okay. All these things that we were told initially that aren't okay, don't use steroids. Well, now everybody gets steroids that's in the hospital. So I think that without science and without data, we aren't going to learn about the virus. And so I encourage people to get tested. And I think like the data is really important in driving some of our decisions going forward. If anybody else has anything to add on that, that would be great.
Okay. Thank you, Dr. Albrecht. Another question that just came in, with regional hospitals filling up, such as Fargo, St. Cloud, and the Twin Cities, are we getting to a critical tipping point for hospital care if needed?
I think we're getting tight, right? We're getting to that point where we're keeping people that we didn't otherwise keep at Lakewood, and they're asking us to keep people in our smaller hospitals. And St. Cloud is trying to help us with specialists like on the phone if we need help so that we're caring for people safely. But they don't have any beds available right now. Like sometimes they can't accept any of our patients, or they can only accept, they'll say, well, we can only accept, newborns that are sick or certain areas that are sick. They just don't have any of those medical surgical beds. And so, for a while then we were sending people to Fargo if they needed to. Well, now Fargo doesn't have beds. So there is a hotline for us to call if we absolutely need to send people that are critical and too sick for us to take care of at Lakewood. There is a hotline we call and they will find us a bed. That's still working right now. But are we able to care for a lot of people safely, in our hospital if we have those connections, if we can reach out to a neurologist and say, okay, we're keeping the stroke patient here like you asked us to, but we need some help on medical guidance on a few of these things. And the physicians around the state have been fantastic with that. So I think we're still providing really good care. Do not be afraid to come to the emergency department. Do not be afraid to seek care. You need to come in. We still have a safe way to take care of people. And it's better to come in too early than too late. I think that's going to be one of these things with COVID that we're going to see is that people delayed their care. They didn't come in when they were having chest pain. They didn't get their heart attack treated right away. Well, now they're doing, now we're treating them, their symptom management instead of actually preventing the heart attack like we were able to in the past. And we're seeing some delayed strokes and other things like that in the community. And we don't want to see that. We want people to come in when they're sick and still get the care they need.
Great information.
Yep. I would just say, I mean, we do make sure that we are participating on the statewide calls, and that we are doing reporting. All statewide hospitals are asked to report in their availability as far as beds. We try to make sure that we're always participating in that. Getting the updates actually have been asked to be increased in frequency so that they have just a little bit more real-time data as far as looking for open beds. As Dr. Albrecht mentioned, there is the special line that we can call, what they call the C4 line. And those calls actually we are participating in daily. And so far they have been able to keep up and get everybody placed. It just might be not quite those typical transfer patterns that people are used to, but they have been able to get those individuals placed. And so we just keep working to, like I said before, manage the patients that we can safely manage here, so that we can try to keep as many beds open in those other facilities as possible. So like I said, that it gets tighter each day.
Thank you, Corrine. Appreciate that. I believe that was our last question. I don't see any more. So I think with that, I want to thank all of the presenters tonight. You did a fantastic job sharing this information. I think it's important for the community to educate them on where we're at so far and potentially where we're headed. So you're all doing wonderful work. Thank you so much for all your efforts. We're with you in this fight, and so we continue to support each other, and that's important. So thank you all. Thank you everybody that tuned in tonight as well too. Have a wonderful night.
Thanks, everyone.
Yeah, thank you, and thanks to the media and Staples World and others who help keep this information out front for everyone. So thank you.